Hello and welcome to our case study series for patients who are treated with the Damon System at Borgan orthodontic practices. Today we are discussing Ahmed's case. He was 15 years old when he came to our practice and his main complaint was the look of his smile, especially the upper right canine. Let's have a look at Ahmed's intraoral photos. We can see right away what's the main problem. This is the buccally displaced or ectopic canine. Otherwise, we have half a unit class 2 molar relationship on both sides, and there is also a crossbite on the left side. In the occlusal view of the upper arch, you can see how much the upper arch is constricted and that there is no space for the eruption of the upper right 3. In the lower arch, there is moderate crowding in the anterior segment, but we can also see a severe rotation of the lower right 5. Let's have a look at Ahmed's lateral ceph. You can see clearly Ahmed is a class 1 skeletal case. So we have a half a unit dental class 2 and a skeletal class 1. What are our treatment options? Traditional option using conventional brackets will involve expansion first using an intraoral palatal expanders like Hyrex. But in addition, most orthodontists using this approach will also extract 4 premolars because they will be worried of the excessive proclination of the upper incisors. At our practice, our main operating principle is to provide non-invasive orthodontic treatment, and we aim to avoid extraction of premolars if all possible. Therefore, our treatment plan for Ahmed is to utilize the Damon system and employ a smile protection bracket placement protocol as we are happy with the amount of incisal show. This will expand the upper arch, and by using low torque on the lateral incisors and a standard torque on the central incisors, we will be able to prevent excessive proclinations. Let's have a look at the torque selection. As you can imagine, this is the most important step in setting the case for a beautiful finish. For the upper incisors, we want to choose low torque so that we avoid the proclination that could happen. However, we always want to maintain a torque difference between the centrals and the laterals. Therefore, we will pick a low torque for the laterals and a standard torque for the centrals. The upper canines are buccally displaced, and the usual advice is to use low torque. However, in Dr. Borgan's experience, he's more favorable toward choosing a standard torque rather than a low one. As for the lower, we prefer a low torque for the lower incisors and high torque for the lower canine, which is what we use in 95% of the cases. This is the bonding visit, and you can see in the buccal view now that we placed a conventional bracket on the lower right 5 because it's with this degree of rotation it will be difficult to place a Damon bracket accurately, and with such a precious bracket you don't want to waste it until you have a reasonable alignment. You can also see the bite razor or the deprogrammer we're using, where we need to open the bite a little bit to protect the interior bracket and also help correcting the crossbite. And here we have the left buccal view. Now, there are a few elements that it will be helpful we talk about with the first visit. We have the stoppers, elastics, coil spring, and power chain. Let's talk about the stoppers first. The rule with the stopper is to place it mesial to the crowding area. On the upper arch, usually this is distal to the upper centrals or laterals. However, when the crowding exists in the anterior segment, then we will place the stopper mesial and distal to the most aligned incisors. On the lower arch, we will place one stopper mesial to the most straightened part of the wire. We will also use a sectional power chain. This is a 2-unit wide Aramco Grey Generation 2. This will help with the early derotation of the lower right 5. At this stage we will not engage the upper right 3, but we will place open coil spring activated by half a bracket width to create our space. Now as for the elastics, these are 3/16 medium, which is called Rabbit in the Aramco lineup. You can also see on both sides we didn't extend the wires to the second molars on the bonding visit. This is mainly to reduce the risk of the wire coming out of the tube of the second molar and needing an emergency appointment to manage. Now in the occlusal view you can have a better look at the open coil spring, which is a light medium night eye, and this is activated by not more than a half a bracket width. We want minimal forces. As in most cases, we're starting with 14 copper night eye wires. In the second visit, we will change this to 14/25 copper night eye. In the lower occlusal view, we can see the position of the stopper, and it's a good thing to remember. You need always leave a space of about 0.5 millimeter between the stopper and the bracket. Also better visible in this view, the bite razor or deprogrammers on the buckle cusp of the lower first molars to open the bite slightly and protect the bracket. Now, this is the third visit, around 6 months into the treatment, and enough space has been created for the upper right canine and we're ready to engage the tooth. But we will go back to our initial wire, which is 14 copper night eye, so that we are applying very minimal force. The aim is not to bring the upper right canine in class 1 occlusion right away, but we want to move the canine with the surrounding bone in the right place and to achieve an equal gingival level between the upper right 3 and the upper left 3. In this view, we can appreciate better the space created for the upper canine now. We can also see that the lower right 5 is in a good position, and the wire on the lower has been changed. We can also see that the crossbite on the left side has been corrected. This is an occlusal view of the visit, an upper occlusal view, and this is a lower occlusal view. You can see that the bite razor have been removed because we don't need them anymore. Now we are in the pano repo visit, and this is nearly halfway through the treatment. We can see the nice level of the upper right 3, which is nearly identical to the upper left 3. We didn't need to reposition any brackets, and we are starting power chain to close the spaces in the upper arch. You can see that at this stage only, we are ready to bond the lower right 5 with the Damon bracket. Now, in this visit, we performed IPR for the upper incisors, and we started finishing wires at 1625 stainless steel for the upper and 1825 stainless steel for the lower. We also did an IPR for the lower incisors. Here we are at visit 10, 24 months after the start of the treatment, and we have a beautiful result. The treatment could have finished earlier, but due to Ahmed's A-level exams, we had to space the appointments. This is a very beautiful smile where we have managed to bring the upper right 3 into the right position. We can also see the gingival level is the same as the left side. At the same time, we maintained the position of the upper incisors and avoided proclination that could have happened with the traditional brackets. This is the buccal view of a class 1 relationship, as well as that on here we have the left buccal view, and this is our occlusal view. I need to mention that our orthodontic therapist has placed the upper fixed retainer in a more incisal position that we would like, and this will be changed later on into more gingival position. This is the lower view, and we have a nice alignment, and this fixed retainer is in a good position. Let's have a look at Ahmed intraoral photos before and after. Very good results. Looking at the lateral ceph, we can see that we maintained the angle of the upper centrals and avoided the proclination that would have led some clinicians to advise extraction to treat such case. But with passive self-ligation and proper protocols, we can achieve great result without extraction. Looking at the profile photos, we can see the lips are composite and not protrusive. And most importantly, we have great smile. Happy patient, happy orthodontist. Thank you very much.